What we've been hearing is that Michael Douglas has throat cancer. The type of cancer that he has is called a squamous cell carcinoma, which is by far the most common type of cancer in the throat, and also the most common type of cancer that occurs in the mouth. Maybe 10 or 15 years ago, the majority of these cancers and patients walking into our office were smokers and drinkers, usually in their 60s and 70s. And what we're seeing now is the majority of these patients tend to be younger, patients in their 40s and 50s who don't smoke and drink. So really it's almost like anyone could get these cancers. For people who get these cancers, the risk factor seems to clearly be association with human papillomavirus infection. Non-smoking, non-drinking younger patient who gets cancer in this specific part of the throat, the prognosis is actually quite good relative to somebody who smokes a lot and or drinks a lot. In fact, the chance of being cured of this disease is around 80%, or maybe even a little bit higher, whereas the numbers probably aren't so good if you're a little older and you smoked a lot. Upfront treatment is usually surgical, frequently with some sort of reconstruction, very often followed by radiation or radiation with chemotherapy. One may have symptoms or may not. When the tumors do get to a certain size, one may start to have pain. That pain can be referred to the ear, difficulty swallowing, weight loss. A very large tumor in the throat can cause even difficulty breathing. When these tumors occur lower down in the throat and the larynx, you might notice a change in your voice, sometimes coughing up blood. So I would say that any lump in the neck that one develops that persists for more than a couple of weeks, and very often people come in, they've been placed on antibiotics, it doesn't get better on antibiotics. Don't assume that it's an infection or just a swollen gland. This could be an early sign of